report till the next board meeting. So I do not have one for today's board meeting.
Okay, we will move on to the medical staff credentials report. Dr. Burley or Dr.
Yeah, I think I've got it here. Let's see, starting off, there were a number of individuals granted provisional status. These were mostly through radiology and the emergency room services. We did have two individuals, a Dr. Ronald Dudek in OB and a Dr. Anton Ingram with the Department of Surgery. Both were granted provisional status. We had two individuals that were moving from provisional to active status, one being Brian Fisher, Department of Surgery, and a second, Carrie Neese, also in the Department of Surgery. And we had a couple of reappointment, two nurse practitioners, Cindy Key, family nurse practitioner, and Raina Tomlinson, also a family nurse practitioner, both in the Department of Emergency Medicine. And we had one individual from internal medicine, Dr. Nadar Bajiri, who has been reappointed to the active staff. And there was one resignation in the Department of Emergency Medicine. No temporary privileges were granted, and there were no issues noted with any of the individuals moving into the provisional or active staff, and no issues with any of the reappointments. And I would like to move to have these individuals approved and accepted.
Are there any questions regarding the medical staff credentials report? Okay, hearing no questions, I will entertain a motion to approve in a second the medical staff credentials report.
So moved, Bonnie.
In a second.
Rhonda?
Okay, thank you. Any further discussions?
I'm sorry, I lost my sound. Are we ready for the?
Yeah, we've already gotten a motion in a second.
Okay, I'm sorry, I lost my sound. I couldn't hear. Burley?
Aye.
Thank you. Fisher?
Aye.
Manson?
Aye. Aye.
Rhonda?
Aye.
Slovis?
Aye.
Stevenson?
Aye.
Sullivan?
Aye.
And Robertson?
Aye.
Thank you.
Okay, the motion carries. We'll move on to the finance report. The December financials. Miramore, you have the floor.
All right. Just checking to see if Janet or Sharon are going to put the number.
Sharon is, she's
Okay.
about to share.
Okay. All right. Thank you. All right, this is just a quick, this is information only, Madam Chairman. This is a recap of our CARES Act funds through December 31st of this year. We received the 3 tranches last year, the $375,459, and then the big $9.4 million one for the safety net hospitals, which was the big one. And then this is how that money has been drawn down. It was obviously restricted funds specific to COVID. We drew down $2.6 million related to lost revenues in 2020 fiscal year that ended June 30. We also drew down $473,000 of expenses. Those were labor, like for COVID pay differentials or retention payments, plus protective equipment and supplies, and for some pharmaceutical agents to treat COVID, such as remdesivir. So that was 2020. We basically drew down 3 million of the 10.2. And then thus far through 6 months of 2021, we've drawn down $3.4 million related to lost revenues and $1.5 million related to expenses direct related to COVID care, leaving a balance of roughly $2 million as we move through the last 5 months of this fiscal year. So I just wanted to give a recap. I try to do that each month, just information. Next is our critical capital. At the last board meeting, we requested and the board endorsed a request for roughly $2.5 million of critical capital for the hospital because we did not receive any capital in the city's capital budget for fiscal year 2021. The administration asked us to narrow that 2.5 million down into something more digestible, roughly $1 million that would potentially be eligible for CARES for 4% funding in this fiscal year. And I think Chair Fagans was kind enough to actually send that letter on behalf of the board. And Dr. Webb and I actually had a brief meeting with some leaders from the administration this week to actually talk through these 4 items. So this is just an update on the 4 items that made the $1 million list that was presented to administration this week. Right, next is, this is our initial budget proposal. It was approved just at the Finance Committee prior to this meeting. This is our initial budget proposal, just so that everyone's clear. We will bring this budget, present it to the Metro government and the Metro Council, and then obviously we will update January financials and February financials probably before this is sort of final reviewed and approved by the council. At that time, I'm sure these numbers are going to change. And we will come back to the Finance Committee and the board for final approval, a final budget for fiscal year 2022. This is what my finance team and the executives around the hospital have put together. A lot of unusual issues to try to project for 2022, and just sort of high level inpatient volume. You can see we're projecting roughly 7% increase over our 2021 actual projected. You can see admissions and patient days basically flow with that. Our observation volumes are down this year. Our ER visits in the hospital are down significantly this year. And about 75% of our inpatients and OBS patients actually enter the hospital through the ER. So having that ER volume return to sort of pre-pandemic levels would be extremely important. Not there yet. So those are sort of the big items. You can just see the rough numbers on charges. $216 million in gross charges in 2020, up to almost $250 million in this year projected, and then $275 million next year projected. After you take out the contractual adjustments and so forth, you can see the net patient revenues, $38.7 million in the year we just closed 2020, rising to projected 46.1 this year. And we're projecting it to rise by another $3 million in the budget for next year. So that's pretty healthy growth on our self-generated charges and revenues. The big item that's a gap is, if you drop down 2 lines, you can see the other revenues. This is where the CARES Act dollars that we are not budgeting for those to be available to us in 2022. There's been no affirmative action taken by the federal government. We have no knowledge of any net new dollars that would be made available to hospitals, safety net or otherwise, for fiscal year 2022. So that's a significant drop. That's an $8 million drop year over year. And that's what creates sort of the biggest issues that we have for budget next year. The city supplement line, is up to 49.5 million. That's the last dollar in, as most of the board members are aware. And that's basically to break even, make the hospital break even for the full budget year. Our salaries are rising roughly $2.3 million. That's a combination really of a couple of things. One is that we have a 2.5% increase in wages forecast for next year. It is also the conversion, as you look down 2 lines, of our contract labor being reduced from roughly 5.4 million this year to 4 million next year. So those people presumably employed directly by the hospital would impact the salary expenses. All in, total contract labor and salary expenses would only increase about 2.8% next year, which is less than what the volumes that we're projecting would increase next year. Supplies are rising a good bit. It's a little hard to peg right now. Costs of supplies just in general, not just COVID, have sort of gone pretty high this year. Pharmacy costs as well. And then the fact that the hospital has entered into some higher supply cost lines, interventional cardiology, obviously we have a full-time provider. Interventional radiology, we have a full-time provider. And we have 2 full-time orthos, a full-time podiatrist, and now 2 employed general surgeons. And then Meharry has a group of 2 general surgeons as well. So as they get busier, we do expect our supply costs to continue to rise next budget year. All in, we see our expenses rising about 3.5% to $115.5 million next year. So like I said, this is a preliminary budget. It is very likely to change a little bit as we update the January projections, but I don't expect the budgeted numbers in the green column to move much at this point, unless we learn that there's potential for any additional revenues, those other revenues, non-recurring revenues related to the CARES Act in fiscal year 2022. So I just wanted to get this to the Finance Committee and the board for initial review. The timing from Metro is that we will probably provide this budget to Metro and to the council in the next couple of weeks. And then they will schedule hearings likely in March. And sometime after that, when we learn what they are willing to preliminary fund the hospital, we'll have to update these numbers accordingly. We will bring those back to the Finance Committee and the full board for approval at that time. So that's my budget report for the board today.
Are there any?
I'm sorry, go ahead.
No, go ahead. I'm sorry.
Well, I was just going to move into the financials, but some may have a comment on the budget.
Yeah, I was going to ask, are there any questions?
Yeah, Bruce, just looking through it real quick on the contract labor, that's going to go down 25% year over year. That seems aggressive. How was that decision made?
Well, actually, January and 3 weeks into February, it is starting to improve, Joel. We've done some things to recruit net new nurses, some new grads. We've offered some unique sort of PRN pay for staff to stay, nurses, or to reattract some nurses that had left us during the pandemic. So I don't disagree that it's a little aggressive. It's got to get better. It is a line item that just eats every hospital alive right now. And I think a lot of the traveler opportunities for nursing and ancillary areas like respiratory are starting to settle down. The attractiveness of the dollars is starting to be reduced. So, I'll just tell you, 2 months ago, I think Veronica and I have had several conversations about critical care nurse contract labor. It's gone from $73 to $140 an hour. That's just not sustainable. I don't care if you get Vandy reimbursements, that's just not sustainable. So we are seeing some improvement already. I think we looked in January and February and our contract labor is down about 30%. So I know it looks aggressive, but we're seeing it right now. I think the challenge is, are we really seeing subsidence with the virus, or is this just Act 3, we're getting ready to enter Act 4 2 months from now? It is an educated guess.
Right, understood. And then on supplies, that seems that rising, outpacing patient revenue. Is there a reason the supplies would outpace the revenue side of things?
It is right now, just because our surgery volumes have been suppressed, just because patients are choosing not to have their knee replaced or their shoulder done. We're still not seeing the elective volumes that we have traditionally seen here, and we've added full-time interventional cardiology and full-time interventional radiology. And like it or not, they're fairly expensive service lines from a supply standpoint. Obviously we're going to try to keep that number down, but I just think it would be, we've seen 3 or 4 months worth of the supply cost here in the hospital. We've been running probably closer to 1.3, 1.4 million a month with those full-time services. So I know it looks big by comparison, but we had such a subdued number from supplies late in 2020 and then early part of this fiscal year. So I think the numbers are sort of tricking us.
Okay, thank you. No more questions from me.
All right, these are the financials for the month of December, and in the interest of speed, I'm going to go through these real quickly. Our patient volumes were up about 10% inpatient last month, although our observations are down slightly. Emergency room volumes are still running about 20% behind budget, and that's been pretty steady for a few months now. And our clinic volume was actually up last month, even in the holiday month, and our clinic volumes, I know after the snowstorm last week, but our clinic volumes are approaching that 3,700, 3,800 visits, I think, that we're going to see very shortly. And we actually have a very aggressive budget next year in the clinics to rise from 40,000 annual visits to 46,000. So significant growth there, and that is a good sign for the hospital, obviously, as well. Surgery cases, inpatient and outpatient, were below budget, fairly consistent with recent months. Cath lab volume is obviously trebled what the budget was with the full-time interventional cardiologist there, as well as the radiologist there. Deliveries were basically on budget, improved from last month. And you can see the hospital case mix is up substantially. It's just a reflection of the intensity of the cases that we've been performing. Those are probably the highest numbers since I've been here. That reflects some of the severe cases that we've had, respiratory and otherwise, in the inpatient setting. So those are just sort of the bellwether stats for the month of December. Income statement, as I said, the intensity of service on the inpatient side has been elevated. Those case mix indexes show that. So even though our patient days were below budget, our actual revenues on the inpatient side were well above budget. Our outpatient revenues were hurt primarily by the shortfalls in ER visits and our observation visits, which are ER visits, even though they're in an inpatient bed. Those are the two big impactors of why our outpatient revenue is falling shy of budget. In total, after deductions, we produced a little over $4 million in terms of net operating revenues. And then you can see where we benefited versus budget. We're in the line items, other revenue and essential access. The other revenue reflects the dollars from the CARES Act for lost revenues in the month. And so that gives us two nice positives there of over $800,000 for the month. So net revenue, all sources, 9.6 million, almost $500,000 better than the budget for the month. Dropping into the expenses, and Joel, you can see contract labor, it's still high. It's double what we had budgeted last year. Of course, we didn't see a pandemic at the time, but it's a little lighter than it was in November And I think you're going to see when we do January next month, you'll start to see those numbers decline a bit. Our supply expenses that you were questioning, you can see it's almost 1.4 this month, and 1.4 times 12 is 16.8. So our $17 million number is probably not that far off in a projection standpoint. Our other expenses relatively in line. Expenses were about 500,000 higher than budget. The bulk of that is in salaries, contract labor, and then supplies. That makes up 80% of the variance. We did end up with a small positive margin for the month of roughly $70,000 compared to a budget of 130. And so in quick, that's the financial statements for the month of December. And that's it. Any questions?
Okay, if there's no questions, I'll entertain a motion to approve in a second the December financials.
Motion to approve, Joel.
Can I get a second?
Second, Ranga.
Okay, thank you. Any further discussions? Hearing no discussions, all ayes.
Burley,
Somebody else be moving the slides.
Burley, I'm sorry.
Moving the slides.
Aye.
Yes. Yes.
Fisher,
Sharon or Janet?
Aye.
Manson,
Aye.
Ranga.
Aye.
Thank you. Slovis,
Aye.
Stevenson,
Aye.
Sullivan,
Aye.
Robertson.
Aye.
Thank you.
Okay, the motion carries. And now we'll hear a report from Pastor Stevenson on the CEO contract status.
I'm sorry, Chair. We are still in the evaluation process, and we have another meeting, so I'm going to ask for just a little bit more time.
Okay, thank you. We'll move on to the CEO report, Dr. Webb.
Did you get banks because you bounced it for me?
They have.
Okay. It was also under the finance report, according to the minutes here, or the agenda contract status. That's for the CEO. Okay, so the CEO report. I'm going to start with the CEO update that was sent to you prior to the meeting yesterday. Should have been. And I just want to point out a couple of items here. One of them is the recognition of the patient-centered medical home through NCQA, National Committee for Quality Assurance, of the internal medicine clinic as a patient-centered medical home. So kudos to the ambulatory division for continuing to achieve those standards of care that allow them to garner that recognition. We met with the under the PSA agreement, professional services agreement. We met with the mediator on the 10th of February. He subsequently met with Meharry to go over similar items, and they were two separate meetings, and has submitted, as of the 21st, a term sheet that we're going to be working through with him. We have a follow-up meeting scheduled with him. I believe it's on the 10th or 11th of March to meet with him and follow up on the term sheet. So that's the status of the PSA. Bruce mentioned that we met with the mayor's office to go over the 4% budget request. There is one item in the CEO update, a portion of the report there under the Metro 4%. We did not meet with the Metro Council Budget and Finance Chair. We only met with the mayor's office and staff members there. So you saw the particular equipment that we were requesting in the finance report. So I won't go over that. Just want to, under patient story, highlight the fact that Reverend Enoch Fuzz, who is one of the members of the Nashville General Hospital Foundation, board as a board member, and is also pastor of Corinthian Missionary Baptist Church, who was one of our patients, was, this is not a HIPAA violation, so I will mention that he was diagnosed with cancer, has been under our care. And there is an item in the Nashville Pride that chronicles his journey as he narrates that. So if you're interested in seeing Reverend Fuzz's feedback on his care that he's received through the process here at Nashville General, you can find it there. We're going to be reaching out to the board members for a photo and tour. We want to capture our board in headshots and post that prominently in the hospital, possibly be in the boardroom. The final decision of that hasn't been made yet, but we're going to be reaching out to you in small groups. We will make sure that we are respectful of the Sunshine Law as we do that. So you can expect those calls to be coming in. Just a reminder that our kids program will be wrapping up Soup Sunday this coming Sunday. And if you look at your the CEO report, you will see a link in that segment that will allow you to go and respond by making a donation if you so choose. Just want to also mention that our own Dr. Bullock was featured on the cover of the Nashville Medical News In Charge Healthcare magazine. And she was featured as one of the city's 6 physician leaders. So congratulations to Dr. Bullock for that recognition. Vernon Rose, the executive director of the foundation, was also recognized. And she was being recognized by the Nashville Business Journal and as women of influence. So kudos to both of those individuals for their recognitions. That's what I have in my report. Happy to answer any questions or clarifications that you might have.
All right, thank you, Dr. Webb.
Okay.
So we'll go.
This is Bonnie. I have a question.
Yes, ma'am.
So how far apart are we with the PSA terms as you've reviewed them?
Dr. Slovis, probably the major area of disparity is going to be in the one that we've always been aware of, and that is the physician hiring,
right,
and the resources associated with that. We're just going to have to work through it, see if we can find some common ground. I don't think far apart.
Yeah.
It is critical, though, that obviously you know this, and we've talked about this on numerous occasions, that the organization maintain substantial control. So
right.
That's going to be a challenge, but you know, the mediator's working hard, and we're both. I think both groups are working hard to find common ground. So we'll see how.
You think we're getting closer?
Oh, we're definitely getting closer. We have a, we at least have a term sheet
Okay.
ready to sit down and start speaking specifically to terms with a mediator involved. So I think we're making progress.
And I had one other question. What % of our employees, staff, and everything are getting the COVID vaccine? what's the acceptance rate, uptake rate?
I think I'm gonna let either Dr. Bullock or Dorothy Bennett respond to that
I'm
one.
happy to answer it, Dr. Webb. Roughly last week, we were at about 46%. Those have changed very recently, but we're still tallying. We have about 10% back still in first dose. So roughly about 46% of our employees. And we're continuing to get more and more as time moves on.
Yeah, so we're just still trying to, you know, encourage that, obviously promote that.
Absolutely. And we do have a limited allocation. So, but we have been able to make sure there's an allocation enough weekly for any employees that may change their mind, any new employees that come on board.
Okay, but we could get an allocation to immunize all of our employees if they all chose to take it.
Yeah, so our original allocations were to immunize all of our employees. And, over time, people are initially said no, they continue to increase and continue to say yes. So we expected that number to be a little low at first, and it is continuing to rise.
Great, thank you.
And Dr. Slovis, did you receive the report, the CEO report?
Yes, I have that.
Okay, good. Thank you, Dr. Bullock. Are there any other questions for me? All right, I will yield to the board chair.
Okay, so we'll move on to the board chair's report. Last Sunday, through my sorority chapter, which is the Nashville Metropolitan Alumni Chapter of Delta Sigma Theta Sorority Incorporated, we brought snacks to the emergency room staff, which they were very grateful, and we just wanted to show our appreciation for their support and sacrifice and hard work. And so we had the opportunity to take pictures with some of the staff in the ER, and they really enjoyed, and I'm sure they're going to continue to enjoy the snacks. We brought a number of snacks for them. So that is my report. We will move on to the public comments. Are there any public comments? Okay, seeing that there are no public comments, Dr. Webb, do you have any further comments before we adjourn?
I do not. Thank you.
So without any further ado, hearing no other opportunities for discussion, I'll entertain a motion and a second for adjournment.
So moved, Ranga.
I'll second. This is Stevenson. And also want to note, as I'm second this motion, that I was reappointed to this committee, so I'll just celebrate that myself. Thank you.
We are so excited that you were reappointed.
Yeah, busted. That's right. Make them do right, Stevenson.
I'm not saying anything else, but okay. I could call some people out right now, but I'm not going to do that.
I'll second for adjournment.
All right, great. So all ayes.
Burley.
Aye.
I'm sorry, Fisher.
Aye.
Manson.
Aye.
Ranga.
Aye.
Slovis.
Aye.
Stevenson.
Aye.
Sullivan. Sullivan. Robertson.
Robertson, aye.
Okay, Sullivan. Okay, I think we lost him.
Is that everybody?
That's everyone now.
Okay,
Aye.
Oh, Sanders.
all right.
Sorry about that.
Yeah.
Before we adjourn, I just want to say that I was informed by Dr. Bullock that as of this afternoon, there is half a box of cheese peanut butter crackers and all gone in less than 2 days. So, sorry, there are no more snacks. We are adjourned. You guys have a great evening. Good night.
Good night.